Assalamualaikum and very good morning to all learners and viewers. I am Assistant Medical Officer Nick Abdul Mohamed from Health District Office Kota Bharu, and I am one of the facilitators for our Health District Office Basic Life Support Team. Today I am going to teach on how we can manage and rescuing an adult choking victim that is still conscious. This is Choking Charlie, and he is going to help me in demonstrating the steps that we can use and perform in rescuing an adult conscious choking victim.
That's the way, but I want you. Emergency, it's good for us. That's the way you are. Emergency, it's good for them. That's the way I am. Emergency.
For your information, the universal sign of choking is the victim will crossing his or her hand to the neck while try to expel the foreign body from their airways. If you see the victim trying to cough and having an effective cough, you should not try to interrupt them, but you can encourage them to cough and trying to expel the foreign body by themselves. After observing the victim cough for a while and the victim show the sign of ineffective cough, that is cough without sound, blueness of the face and any others, the rescuer need to initiate the further step, that is 5 back blows and abdominal thrust to help this victim. To perform a good back blow and helping the adult conscious choking victim, the rescuer must follow all the necessary steps, such as, first of all, we must position our body behind the victim, and then we give support to the victim with our hand, while the other hand will be used to deliver the back blow. To deliver a good back blow, the rescuer must first locate the victim's shoulder blade, because we will deliver the back blow between the victim's shoulder blade while supporting their body. Now we have located the location to deliver our back blow and support the victim. Make our hand like this, and now we will deliver the back blow. 1, 2, 3, 4, 5. The foreign body are still not dislodged from the victim's throats. Look like we have to proceed to second step, that is abdominal thrust. Because 5 back blows given earlier to this victim unable to dislodge the foreign body, now we will proceed to the abdominal thrust step. The concept of abdominal thrust in rescuing and managing an adult choking victim that is conscious is that we want to deliver a quick and precise thrust to the abdomen of that victim. This thrust will force the victim diaphragm to push out the foreign body from that victim airways. First of all, to deliver a good and effective abdominal thrust, we also have to follow all the essential steps. Ask the person permission. Sir, now I am going to give a quick thrust at your stomach to help you cough out the foreign body. When the patient gives permission, we may proceed to the abdominal thrust step. First of all, position your body behind the victim, just like when you are performing the 5 back blows before. After that, put your leg between the victim leg to stabilize both rescuer and victim bodies. After ensuring both of the rescuers and victim body are stabilized, now you need to feel the victim belly button and the victim rib cage. Make a fist. Put the knuckle of your fist between the victim's belly button and rib cage. Grab that fist, and now you are ready to perform the abdominal thrust. Count 1 until 5. 1, 2, 3, 4, 5. As you can see, while performing the abdominal thrust, I am trying to push inward and upward to the abdomen of that victim. This precise and quick abdominal thrust usually will help the victim to expel out the foreign body from his airways. After complete 5 abdominal thrusts, you need to observe the victim condition and the foreign body. Now, as you can see, the foreign body already dislodged from the victim throat, and I have successfully helped this victim clear out his airways. As I'm already explained, there are 2 steps in helping a normal, conscious choking adult to dislodge the foreign body from their throat. But how do we know when we want to switch between the 2 steps, that is 5 back blows and 5 abdominal thrusts? For learners' information, after giving 5 back blows and the foreign body still not dislodged from the victim's throat, the rescuer may straight away proceed to 5 abdominal thrusts. The rescuer will continue to deliver 5 back blows and switching to 5 abdominal thrusts until the foreign body is dislodged from the victim's throat or until the victim becomes unconscious. After the victim becomes unconscious, we will put the victim flat on the floor and we will continue the skill of unconscious adult choking victim. Usually, To help unconscious adult choking victim, we will initiate cardiopulmonary resuscitation or CPR to this victim.
Tiada beza, bertanggung jawab amalan kita, kesihatan dan maruah dijaga.
But there is also a special reconsideration and special step when you encountering a victim adult choking where the victim is pregnant or very obese and you cannot completely wrap your hands to the patient abdomen or stomach. When encountering a pregnant victim, the rescuer may consider to perform a chest thrust to that pregnant victim. For a pregnant victim, the rescuer may consider to perform a chest thrust to that victim because this is less dangerous comparing to abdominal thrust. Now let me demonstrate how we can perform a chest thrust to a pregnant victim. Just like when you performing the abdominal thrust, in performing chest thrust, you may also place your body behind the victim's body. Okay, after that, you try to feel the victim breastbone and place your fist on the victim breastbone. When you're ready, deliver a quick in and upward thrust that victim chest. Ready? 1, 2, 3, 4, 5. Okay. You may switch between 5 chest thrusts and 5 back blows like we did earlier in performing the abdominal thrust.
So don't even trip. Someone will eventually push that button. Stoke that flame.
There are also special reconsideration and step when we encountering an adult choking conscious victim, but the victim body is very big or very obese. In this condition, the rescuer cannot reach that victim's chest or cannot fully wrap the victim's abdomen. The best way to perform rescue step for this victim is by helping and assisting the victim doing self-Heimlich maneuver by using a chair that will deliver thrust to their abdomen or diaphragm. If there are no chair available, the victim may be instructed by the rescuer to lay flat on a floor while the rescuer performing abdominal thrust to that victim with the same concept, that is, fast and precise quick thrust to the abdomen, and the point of the thrust is between the victim belly button and rib cage. Finally, let's me demonstrate the full one cycle of 5 back blows and 5 abdominal thrusts to a normal, conscious adult choking victims. First of all, when you encountering a adult choking conscious victim, you must not straight away give rescue step to the patient, but you may ask the patient if he or she is choking. If the person say yes, then you does not need to perform back blows or abdominal thrust to that victim. Otherwise, if you observe the victim is having ineffective cough, that is, cough without sound or silent cough, then you may straight give the victim the rescue step, that is back blows and abdominal thrust. But remember to ask the person permission first, or you can tell the victim what you are going to perform to rescue the victim. Let's say today you are going to camping and one of your friend, that is choking Charlie, have foreign body obstruction in his airway, and I am going to help him. Mr. Charlie, are you choking? And the victim say yes. Now I am going to encourage him to cough or expel out the foreign body from his throat. Sir, can you cough? The victim will try to cough out the foreign body. After a while, the victim become blue and there is no sound when he trying to cough. Sir, are you okay? I have observed the victim's skin became blue, and I am going to perform 5 back blow and 5 abdominal thrusts. 5 back blow and 5 abdominal thrusts is considered one complete cycle of rescuing an adult conscious victim that is having foreign body in his or her airways. First, ask the victim permission. Sir, I am going to give 5 back blows to your back. Is that okay, sir? Now perform the 5 back blows with the step and concept that I have explained earlier. 1, 2, 3, 4, 5. The foreign body still in the victim throat. Now I am going to proceed to the abdominal thrust. 1, 2, 3, 4, 5. Observe the patient and the foreign body. Sir, are you okay? Now, I have successfully helped this victim expel the foreign body from his airways. A rescuer must keep in mind it is important for the rescuer to stay with the victim after the foreign body are fully expelled or dislodged from the victim's throat, to keep the victim calm and will avoid the victim to
When
have
I say your
anxiety
prayers, take my breath away.
disorder
It's
again.
emergency, now emergency. When I find your smile, always in my mind. It's emergency, now emergency.